If you have trouble signing in, please use the chat box so we can share a phone number for you to dial in. If you have questions or comments during the call, please use that same chat box on the left-hand side to share. We will be recording this session, and it, along with the slide deck, will be available after the call. Before we get started, I have a few announcements. Our next town call will be on LGBT workplace equality in India. Please note the new date, May 10th, and time, 8:30 a.m. Pacific. Experts from HPI India, Intel India, and Intuit India will share their experience in advocating for LGBT workplace inclusion, as well as best practices for ERG, engagement, and ally development. On May 17th, we will be hosting our Workplace Summit kickoff reception in Philadelphia. And you can join us at Comcast Center for a hosted reception to learn more about what's new and exciting at Summit this year, network with LGBT and ally leaders, and find out how you and your company can get involved with Summit in Philadelphia. Our Pride Business Forum, Out and Equal in Central Eastern Europe, will be held in Prague, June 16th. And Out and Equal is joining forces with Pride Business Forum to produce the largest summit on LGBT workplace equality in Central Eastern Europe. Out and Equal is proud to partner with the Walt Disney Company and Sodexo to organize the Out and Equal Equality Institute this July 6th at the National Gallery in London. And of course, the 2017 Workplace Summit will be held October 9th through 12th in Philadelphia. Workshop proposals will be accepted through May 12th. For more information about workshop proposals or our events, please visit outandequal.org. So we have a quick poll before we get started. Does your company offer transgender inclusive health benefits? You can click on your answer and be sure to hit submit to see everyone's responses. And it looks like that yes, fully inclusive coverage. Some people aren't aware. There are others that it's not fully inclusive. And then a little bit, on the border of considering it, and it's not really on the table at this point. So now we will start with our guest. I'd like to introduce our first speaker, Dr. Maddie Deutsch. Dr. Deutsch is the director of UCSF Transgender Care and an associate professor in the Department of Family and Community Medicine. She has cared for more than 1,500 transgender patients since 2006, is involved in several research activities in the field of transgender health, and has more than 25 peer-reviewed publications on transgender health topics. Welcome, Dr. Deutsch.
Great. Thank you. It's wonderful to be here and to have been invited. I'm so glad that there's so much interest in this topic. And I apologize that unfortunately I'm not able to stay on the call after my slide presentation because of another conflicting call that I have to jump onto. But I will make myself available by email for any follow-up questions or concerns that anyone has. So if we can go to the next slide. Great. So I just want to spend a few moments describing the landscape of some terminology and just describe some of the population characteristics and some health disparities and why it is important to focus on the health needs of transgender people. Transgender is a term that describes a broad population of people who have a gender identity that differs from the sex they were assigned at birth. Gender dysphoria describes the sentiment that someone may have when they feel that the gender that they identify with in their mind and in their soul differs from the birth sex that was assigned when the doctor said it's a boy or it's a girl. And when you're talking about transgender people, there's a term cisgender. Cis means same or next to in Latin, and trans means opposite or across. And so a cisgender person would be someone who is not transgender. Next slide, please. So your gender identity really is more of an internal self-identification. How do I feel I move through the world? What kind of space do I occupy in the world? And that can be female or male, but it can also be other identities such as genderqueer or non-binary. These are folks who say, I've spent my whole life being told I'm supposed to be male. I'm not male, but I'm not female either. I'm something else. I'm my own gender. And the most important thing is that we just respect people and find ways to support them in their health or in their workplace so that they can perform optimally. Your gender expression is more of how you outwardly present your gender to the world. So this can be a feminine or masculine or androgynous presentation. And it's not necessarily linked to your gender identity. So just like non-transgender or cisgender people can have gender expressions that can be feminine or masculine or androgynous regardless of their sex or gender, transgender people may also have the same variability in their presentation. So all transgender people are not hyperfeminine or hypermasculine. And then lastly, just sexual orientation, it's really a multidimensional representation of your sexuality, who you're attracted to, the kinds of sexual activities you engage in, the genders of your partners. It's not the same as gender identity. There is some overlap in some concepts, but it's really different. So you wouldn't say as someone gay, straight, bisexual, or transgender, because that would be saying, are they a car, a plane, a train, or an orange? It's really different. If we can go to the next slide. So a transgender man or a transmasculine spectrum person would be someone who had a female birth assigned sex and identifies as either a male or on some kind of female, masculine spectrum. And then the converse would be the case for transgender women, trans-feminine spectrum. And then gender non-binary or non-conforming or genderqueer people, we spoke about that again. These terms, female to male and male to female, they're a little bit older and a little bit outdated. You might still see them out there, but they're not preferred terms. Next slide. Transgender people do have a sexual orientation, and so being very simplistic, if a transgender woman says that she's attracted to other women and that she's a lesbian, well then that would make sense because she has a female gender identity and is attracted to or sexually active with other women, and the same would go for transgender men. So without getting into some of the more nitty-gritty of this, and people will self-identify using a lot of different terms and characteristics. In the case of transgender people, we always use the terminology to describe their sexual orientation based on their affirmed gender identity. So if we can go to the next slide. How many transgender people are there? So now we know who transgender people are. How many are there? Why do we need to focus on transgender people? Well, when we look at a number of population level studies that have been conducted in the last few years, high school students in Boston, a national sample of New Zealand high school students, random phone dialing of landlines in the state of Massachusetts, sub-cohort within a nurse's health study. We see numbers coming up between about 0.3 and 1.62%, and that's consistent across multiple studies. It's about the size of the Pacific Islander population in the U.S. So definitely a non-trivial population, and in some urban areas you might find even higher concentrations. Next slide. So transgender people unfortunately do experience a lot of health disparities, which is why programs like mine at UCSF exist, to try and shatter some of these disparities. This is a sample of Californians statewide from 2008. You can see that 1 in 10 were denied primary health care outright, and that 1 in 3 postponed accessing care even when they knew they needed to see the doctor because of prior discrimination. Next slide, please. This is a national study, the National Transgender Discrimination Survey, which was done in 2011 with about 6,000 participants. There actually was another update done to this in 2016 called the U.S. Transgender Survey. And if we can go to the next slide. Unfortunately, there really wasn't much improvement. I'm showing you the 2011 findings. The 2016 findings really have no change. 1 in 5 report being refused medical care. 1 in 2 reported having to teach their own medical providers about transgender care. And then we see postponement of accessing care. We see high rates of HIV infection, which I'll talk about in a moment. So really a lot of health disparities in this non-trivial sized population. So this is the reason that we really need to focus on the health of this population. Next slide. We also see, this is a sample about 10 years ago, showing that 1 in 3 transgender people have attempted suicide. There's some other alarming findings here as well, with discrimination based on gender, victimized of rape, but even attempting suicide. Now, this is not to say that all transgender people are living with complex mental health conditions and that that's directly related to being trans, but it does show that the experience of being transgender in a transphobic world and the minority stress and additive discrimination that people experience, especially when they're people of color or other dealing with other intersectionalities, can really add up. And again, really why it's so important that we focus on the health of transgender people. Next slide, please. So when we talk about making a diagnosis of gender dysphoria, there are ICD codes, and there is a code in the DSM. The World Professional Association for Transgender Health publishes standards of care that help describe gender affirming care, and it is defined as medically necessary care. So all of these procedures and surgeries, hormone therapy, is defined as medically necessary. We do have these diagnosis codes that are necessary to allow insurance to cover care for transgender people. Next slide, please. So just to very quickly highlight, these are some snapshots of some discrimination policies that transgender people experience. To very simplified, I'm just going to go through these quick. You can go to the next slide. All of the states that are in gray, there are basically no protections whatsoever for transgender people. And there's also no protections, you can go to the next slide, in a lot of these states for gay and lesbian people. And you can go to the next slide. All of these factors add up to transgender people experiencing multiple intersections of discrimination. You can be fired just for being transgender. You can be thrown out of your housing just for being transgender. All of these factors lead to transgender people experiencing gaps in employment and disparities in access to employment and the mental health concerns that I mentioned earlier. Next slide. A lot of this is related to the high prevalence of HIV in the population. When you can't get housing, you can't get a job, you're told that you're worthless. All of these factors add up to both engaging in underground economies or shadow economies, sex work for survival, drug use that stems from chronic discrimination. So these are health issues in their own that transgender people need to access mental health services, substance abuse, etc., HIV care. All of these are interrelated, and they're, again, not just because transgender people are irresponsible or at the core problematic people. You can go to the next slide. So when we do provide gender-affirming care to people, we have improvements in a number of different measures. So hormone therapy has been studied and found to improve scores of anxiety, depression, social functioning, and quality of life. We also have data showing that surgery can have similar improvements on global functioning and quality of life. Regret rates are very, very low. They're less than 1%. They're much less than regret rates for a lot of other things in our society. And the malpractice risk is basically non-existent. We can go to the next slide. When we do provide an appropriate care setting for transgender people to receive their care, we have improved patient satisfaction and retention and improved care. So if a patient walks into a clinic and they get called sir by the front desk and they want to be called ma'am, that patient is going to turn around and leave. And then I, as a primary care doctor, have never been able to detect their colon cancer. Forget about being able to give them the hormones or surgery that they're seeking to improve their quality of life. They may actually just avoid any care, which is going back to some of the stats I'd shown you previously. We can go to the next slide. So some of the ways that we can encourage our clinics to become more trans-friendly is to provide bathrooms, signage or policies that allow universal use of bathrooms based on identified gender, making sure that the atmosphere in the waiting room is inclusive. Maybe there's some flyers or materials. Electronic medical records, making sure they have the capacity to use the chosen name and pronoun and display it in a proper way, and making sure that staff are all properly trained. What can companies do to help ensure this? Well, if your company is engaging in negotiations with an ACO or any other IPA, you might want to add some of these items on your check sheets. This is what's required to participate in our network. So I do some consulting for Inland Empire Health Plan in Southern California, which as a Medi-Cal carrier and they're actually building some of these requirements into their contractual arrangements with different care clinics. And then I have a contract with Comcast where we're beginning to work on developing ways to improve care for their patients nationwide. We can go to the next slide. So some common gender-affirming procedures that transgender people may seek include hormone therapy, a variety of surgeries. They may seek to undergo what's called a social transition, which is where they will tell friends, family, employers, coworkers, I want you to start using this name, these pronouns. They'll obtain updated legal documents. And they may undergo other procedures like facial hair removal is kind of the primary one. None of these are required. There is no special order in which to do these, and there are some transgender people who don't want any interventions. They only want to undergo what's called a social transition without any hormones or surgery. And then there are other transgender people, maybe they only want hormones or only want surgery, and other transgender people want a variety of treatments. There's no one order that's correct. All of these are defined as medically necessary by WPATH, and none of them are required to get legal documents changed, and there's no specific pathway, you have to do this, and that. And then there's also one thing that I didn't list here that I want to comment on, which is mental health services are really important for transgender people too, both to help transgender people figure out what flavor of trans they are, how do they want to undergo their transition, are they trans, what is the right choice for them, how can they come out to family and friends, how can they develop coping mechanisms for the various discriminations that transgender people experience? Next slide, please. So the general approach for hormone therapy for transgender women is some combination of feminizing hormones, an estrogen, a blocker of testosterone, and then sometimes some progesterone. And then for masculinizing hormones, it generally involves treatment with one of several preparations of testosterone. Next slide, please. Hormone therapy can basically have a number of effects on a variety of physical features of the body, and this is just some information here. We'll go through this, but it'll be in your slide set for your reference in the future. You can skip to the next slide. Other procedures such as facial hair removal, very important that this be covered. Transgender women, there are a lot of policies and coverages that will often cover genital surgery, but they won't cover facial hair removal. And that seems counterintuitive to me because when you're walking down the street, everybody is going to see your facial hair. And when you look at yourself in the mirror every day and affirming your own gender, you'll see your facial hair, but your genitals are really not visible to most people. Same with speech therapy. Transgender people, especially transgender women, become very uncomfortable with their voice, and there are a lot of different approaches to changing one's voice through speech therapy. These other procedures, binding, packing, and tucking, are ways of kind of manipulating the breast contour or the genital contour to better approximate the affirmed gender, and there are sometimes prostheses or special chest binder devices that are used and would be wonderful if those would be able to be covered by insurance. Next slide, please. So talking about the different surgical interventions, next slide. There are a number of common surgeries that transgender people may undergo. Some surgeries are not specific to transgender populations, such as hysterectomy, oophorectomy. Orchiectomy is removal of the testicles. And then there are a number of procedures specific to transgender populations. Phalloplasty is creation of a penis. Vaginoplasty, creation of a vagina. Metoidioplasty involves taking the clitoris, which has grown somewhat from testosterone, and refashioning it to have more of a phallus appearance. Mastectomy for transgender men is typically referred to as top surgery or male chest reconstruction because it's slightly different than a usual mastectomy, and also because we want to avoid referring to trans men as having a mastectomy, since that's more of a procedure that women undergo. And then there's a range of facial feminization procedures, including removing of the Adam's apple, called tracheal shaving. I put cosmetic in quotes because really these procedures are not cosmetic. They're therapeutic and defined as medically necessary. They just happen to be performed by a cosmetic surgeon. We can skip to the next slide, please. So with management of transgender youth, there's a lot of benefits of identifying the youth at an early stage who would be appropriate for hormonal interventions. And the kind of take-home point I want to leave you with for this is not only is it important to cover these both puberty blockers as well as hormone medicines in the pubertal age for youth if they have presented as transgender and it is an appropriate way to move forward, but it's also very important to provide access to appropriate mental health services for transgender youth so that they can determine what is the best course of action for them and how to move forward, as well as integrating family and other issues. The next slide, please. We do find that when we provide gender-affirming care to transgender youth, that their mental health outcomes mirror those of non-transgender youth, whereas we find that kids who are not able to transition have poorer mental health outcomes than kids who do not. Next slide, please. Transgender fertility. Transgender people do and can reproduce. Transgender women will store sperm before beginning hormone therapy, and transgender men will undergo any one of a number of preservation procedures. Transgender men can come off of testosterone and can store eggs at a later time. It's a bit more difficult for transgender women. Sometimes the sperm storage shuts down, the sperm production shuts down, so it's important to get that done before they start hormones. And at the same time, these hormones, while they may cause sterility, they don't definitely cause sterility, so it's important to provide contraception coverage for patients as well. You can skip ahead through the next slide, which is just a marker slide, and then go to the next slide, which is health outcomes. We've just got a couple of slides here left. Basically, everything on this slide, this is a long-term perspective, retrospective cohort from the Netherlands, where they compared transgender women health outcomes to non-trans men and transgender male health outcomes to non-trans women. And so basically they're looking at mortality as the outcome. Everything I circled in red, there's a statistically significant increase, and the rest of it, there's no statistically significant difference. So for transgender women, you can see there is an increase in ischemic heart disease mortality compared to men, but they didn't control for smoking and a number of other factors, and what you really can see is that the majority of the contribution to the overall 51% increased mortality is because of things like drug use, suicide, and HIV, and hopefully I've explained to you how all of these are related to being transgender. In transgender men, the only increased mortality that we see, we don't see overall increased mortality, we just see a cause-specific increased mortality relating to drug use, which again is related to mental health issues. So transgender people are actually not experiencing any negative hormone-related health outcomes for the most part. Next slide. So the insurance landscape, just briefly, I know you're going to speak more about this with the next speakers, but again, WPATH defines all of this as medically necessary. A lot of major insurance companies are developing internal guidelines, as I mentioned. There is Medicaid coverage in some states like California. Medicare has recently removed a long-standing exclusion on this care, and now the U.S. military and TRICARE are providing this coverage. I myself have cared for 2 TRICARE patients in the last 2 weeks of active duty military. Next slide. So we learned a lot from San Francisco, who was an early adopter of providing transgender coverage. There was a lot of fear when the city of San Francisco began providing coverage through all of its plans for gender-affirming care for all city employees, that it was going to bankrupt the system. And as you can see, over the initial years of the program, there were not a lot of claims. The total dollar amount of claims paid was really negligible. And there had been a member per month surcharge added, about $1.80 or something, when they first launched this coverage. And after several years of providing the coverage, that fund was actually in a surplus. They eliminated the surcharge, and now it's just integrated into their usual service line. And so this last slide that I'm going to show you here, you can go to the next slide. This is a publication that came out about a year ago that actually looked at transition cost effectiveness from a quality-adjusted life year perspective. So in the U.S., we tend to define about $100,000, maybe $200,000 as an acceptable cost for adding one quality-adjusted life year to someone's life. And it was found that in order to provide transition care, the cost to add one quality-adjusted life year was only $8,655, which comes out to about 1.6 cents per member per month cost. So this is cheap, and it's cost-effective. The cost-effective data is not, we're still working on developing a lot of that, but as hopefully I've shown you that these procedures have a positive impact on quality of life. They're relatively cost-effective, and they're going to make your patients, your employees, happier people because they're healthier people. So with that, I'll turn it over to the rest of the group, and unfortunately I do have to go. This is our program website where there's a lot of information that you can obtain, and you can also get my contact information from there, which is just madeline.deutsch@ucsf.edu. Thank you very much.
Thank you very much, Dr. Deutsch. And as a reminder to our listeners, you can chat in any questions you have specifically for Dr. Deutsch, and we will pass those on to her. So now I want to introduce our moderator for the panel discussion, Rachel Rubin, Chief Operating Officer at Unequal. Rachel?
Thanks, Alyssa, and thank you again, Dr. Deutsch, if you're still on the call. I hope that was a really helpful kind of lay of the landscape of what's going on with transgender health in the medical field, and how physicians are looking at this from a standpoint of return on investment for patient care. Because we know that when we're taking really good care of our employees as individuals and their bodies and their mental health, that they're all more productive at work too. So we're going to get into the nitty-gritty of all of that with a fantastic panel. I think one of our panelists was not able to make it, so I think we're not going to hear from Michaela Mendelson today, but we have Crystal Howard-Dobler and Dana Van de Covering here for a really fantastic session. So we're going to begin with kind of our first question. And before you answer this question, I'm going to start with Crystal and then go to Dana. If you can just talk a little bit about kind of your role at your company and share a little bit about yourself. So tell us about that, and then tell us about your corporate values and why your company offers transgender health benefits and how it aligns with your organizational values. And let's start with Crystal.
Sure, absolutely. Thanks for having me. I work at Bank of America in HR. I also just rolled off of a position in our employee network, our ERG, leading that, helping to lead that for the company for the past 5 years. So I have that intersect point of my volunteer job as well as my day job, and being able to bring some of the LGBT pieces together in that. When we talk about corporate values and our organizational values, diversity and inclusion is important to us, and it's more than just a statement on paper. I mean, we do state on paper that we need to realize the power of our people, which is about helping all employees reach their full potential, and you can certainly weave that into our transgender employees and our transgender employees being healthy and proactive and productive in the workplace. But we also tie it into delivering our products and services to our customers. It's very important to us and fundamental to our ability to deliver our business to have employees that reflect our customer base. And we have transgender customers or potential customers and clients, just like we do LGBT customers and clients in all sectors and walks of life. And we want to and need to reflect that. So this is fundamental to us being able to deliver our company to our customers and clients in a way that makes sense to them and that is respectful, that allows us to connect one-on-one with each potential customer and client. So that's the bottom line for us. Like, we have a long history of this. We started, way back in 1998. That's a long time ago in LGBT history, offering same-sex partner benefits. We've had a lot of tweaks along the way. In 2009, we started offering transgender health coverage. We expanded that in 2014 to, WPATH standards of care, and it's just part of who we are and what we do. And what I will tell you is that we have, people in our benefits department, our HR department, our businesses who want to know what our employees need and want, and are very open and receptive to that. So we are very lucky at Bank of America to have the ability to propose changes, additions, things that we could do differently and better, and have open ears, hearts, and minds to that, and all looking to give our people what they need, and then in turn be able to serve our customers and clients better.
Fantastic, thanks. Dana?
Hi, so I'm Dana Van de Koevering from Intel, and my role is I currently work on our global diversity and inclusion team, and my focus is really working with some of our external partners focused on the women's community and the LGBTQ community. I've been here at Intel for 28 years, and so I worked actually in our benefits team for many years, did some work-life programs, so I was able to go back and learn, and I've kind of along the way was watching coworkers as they were working on our benefits, and very much like Crystal said, is really starting back with the benefits that we offered, same-sex, moving along the lines to transgender reassignment, and then again, very much like Bank of America, we're on that same journey with you, and we were a little bit later than you were. We started in January 2016 where we provide full coverage, again, with the WePath, really following a lifetime, everything is covered, so very proud of that. But going back to why, covering why is this important and how does this tie in with our values, I mean, really, very much like Bank of America, but really offering the benefits, the transgender benefits, and supporting our employees, it really will ensure that every employee can bring their whole self to work. And this is really important to us. It's very much focused in our culture of inclusion, diversity, and our environment is very much focused on treating employees, fair, with dignity and respect. It goes along with supporting our diversity and inclusion initiative. And again, like most companies, it's really becoming a big focus with diversity and inclusion. We all know that the research indicates individuals that serve on diverse, inclusive teams are more open to new ideas, more creative in problem solving, and higher performing. So again, that full inclusive workforce is just going to create productive and creative employees. And something that we're really proud of is this last year in 2016, in honor of Human Rights Day, our CEO, Brian Krasanik, he announced an important change to our Intel values. And so one of our 6 values has always been great place to work. And it was such amazing timing on Human Rights Day where he and our executives made the change to add an inclusive great place to work. So adding inclusive to that, again, it goes along, as I said, really supporting how we are an inclusive an inclusive workplace really within our walls of Intel and our actions and values. And so it was a great testament to the support of BK and our executives to update our values to really reflect our culture. And again, it really stems back to ensuring that our employees can bring their whole self to work. That's so important. And again, it sounds like we really align very much with what Bank of America's philosophy is.
Great, thank you. And I know Michaela is trying to log in, but I don't think she's in just yet. So we'll keep going, and then we'll circle back as soon as she gets into our system. So some companies balk when at what they perceive to be high cost of providing coverage, but research demonstrates that providing transgender inclusive benefits makes little to no impact on premiums. Since utilization is low and costs remain low, but the benefits are really high, what's your sense of the return on investment of offering transgender health benefits? And let's start again with Crystal.
Sure. Cost is one factor. Bank of America has a self-funded plan, which means the costs come through to us for every medically necessary procedure that we cover across our entire employee population. So that's not different in the transgender space, but cost wasn't the main factor when we, decided to offer benefits and when we decided to expand our benefits. We've talked about proactive and preventive being the name of the game in healthcare. Think about how many dollars are spent making sure or trying to help employees be healthy on the front end versus when they have medical issues and concerns. We put a lot of emphasis and attention on wellness programs. Well, transgender health benefits to cover medically necessary procedures could easily be put in that same category, proactive and preventive, giving people what they need, as they need it, and making sure that They don't have to worry about, procedures and or, being and bringing their whole selves to work for whatever reason. Medically necessary is just that. When we look at it, it's medically necessary benefits for all. And more productive, employees that are healthy are more productive, they're more focused, they can show up to work, they can do the great work. Like Dana said, they can be, creative. They can, not be worried about covering aspects of themselves instead of focusing all that energy and attention on the important work that we have to do. So really, the attracting, retaining, and developing the best employees is what we're looking to do, and covering the things that they medically need is just one component of that. So we do not separate out, the transgender healthcare piece from the healthcare that our other employees need. I will tell you that back to the cost factor, sometimes that is what people are looking at in the bottom line. But really, the numbers play out to be negligible and to have, not a ton of employees utilizing the benefits that we're offering. If anything, we'd like more employees to be able to utilize the benefits that we offer, right? And the benefits that they are entitled to as employees. So we do our best at, every opportunity to talk about that. We want that to even be a competitive advantage to attract new talent to our company. The fact that we offer very inclusive benefits, we hope will do that. So if anything, we're looking to use more transgender benefits if we can get the right talent and diverse talent to come here and work for and with us.
Great, thank you. And Dana, how about you all?
I was going to say, I wish I had something really creative, different than what Crystal said, some like magic formula on the ROI. I just want to say, what you said. And that's what we looked at. I mean, and I, again, met with our benefits team too, and that's what they said. It's really hard to calculate and not a way to really on the ROI, like financially. As Crystal said, it's really, at the end of the day, it's very low cost. And the utilization is low, and as you said, too, really lower than we'd like. I mean, we really want to make sure we're communicating and folks really know that this is provided out there. And it's not, and I know it's not a hard sell because of that low utilization and cost. I think it's very much when we were working, like I was on the team when we were looking at adoption assistance. And I remember, again, approaching it, to me, it's a very similar. It's a very low cost, low utilization. And remembering like what I went through, and I was on the team like 15 years ago. And I remember what I went through to get like a $5,000 benefit for adoption, which was really nothing. And it's not even competitive now. And it was a different time for our company. And it was so hard to get that 5,000 approval. And I'm like, but the usage is so low. And so when I talked to our benefits design person recently on, what did it take to get this through? And she said, nothing. I was like, remember adoption, which our adoption benefits, thank goodness, has been increased from those 15 years ago. But she's like, no, Dana, is like, it's nothing. This is who we are. It's our culture. It's like, it's part of our whole wellness and our culture of wellness and taking care of our employees and, again, bringing their whole self. She said, it was easy to pass through. It wasn't like a process. It was definitely the right thing to do. And again, I like what you said, Crystal, about really the focus on attracting and retaining employees and having that competitive advantage as being one of the companies that is known out there for providing and supporting all LGBT community and having all these benefits is to our advantage, and really proud that we're in this space with many other companies. So I don't have a magic formula, but it is absolutely the right thing to do.
Thank you. Great. And I think Michaela has joined us. Michaela, are you on?
Yes, I'm here. Can you hear me?
Wonderful. Great. Success. So let's back up a little bit, Michaela, and tell us a little bit about kind of the work that you're doing, both with Trans Can Work and also kind of how you got started in all of this. and how you're seeing transgender health benefits come into play with retention and really building dynamic teams.
Sure, I'd be happy to, and thanks for the opportunity. And I was on listen-only mode on my phone earlier, so you didn't realize I was there, but so I'm your missing presenter. Here I am. I own a restaurant company. At one time we had as many as 18 restaurants here in Southern California and Central Coast California. And about 5 years ago, we hired one of my managers hired our first transgender employee. And when I heard the horrible situation she had faced in the workplace, even in California, I realized how lucky I was to have transitioned as my own boss, and thought I wanted to start trying to help others. So over a period of about 3 to 4 years, we hired about 40 transgender people in our restaurants. And my other hat was that I support a very large extended family, and had to be a little concerned about how this would work out for my business, even though I'm transgender and wanted to do the right thing. And I think we all want to do the right thing, and be social drivers and as businesses. But I can I go out now and speak to businesses about how well it worked for us, because over 25% of those 40 people we hired did make the pathway to management, and they were entry level into our restaurants. And that really showed, once they were on a level playing field, probably for the first time in their lives, how they wanted to take advantage and show what they could do for us. And they did. And we got more compliments from our customers, many more than we expected, more than per person than anybody else. But customers really appreciated seeing this new class of employee in our restaurants that were so happy with their being on a level playing field, and so happy to be possibly for the first time in their lives working in a job where they could be their true selves. And they developed relationships with customers, and it was just been amazing to watch. So having seen how well it worked, we brought it out to the California Restaurant Association and to restaurants throughout the state. We're working on that this year. But we're also looking to bring it to other groups, all types of other industries. And what we do is, we go in, we have a certification process on trans inclusivity in the workplace, and then those companies that make it through that process, it's not that big of an investment, but it's done in a way that's business friendly, because I've approached it from what I would do for my own businesses. And then we connect them to our jobs boards. Then we have a pool of job seekers then that can seek your jobs. And I want to say that some of the numbers, Maddie made an amazing presentation, and I want to say, though, that some of the numbers she spoke of that came from the recent nationwide survey were trans adults, specifically were 0.6% of the population in the nation. That's 1.4 million. But the recent surveys that are done in major cities throughout the country, and more specifically quantified in California by the California Health Institute and published by the Williams Institute, show over 4.5% of youth 12 to 17 are now identifying as gender nonconforming. So I like to tell businesses that not only is this the right thing to do for social reasons, but we have to all get behind this if we want to be successful business people, because it's way too large of a pool now for us not to take advantage of, and we certainly want to get on the right side of it. So shifting that quickly to the health benefits, of course, when we support our employees to be healthy and happy in the workplace, we're going to get the most from them. And our workforces these days, it has been proven by people like Out and Equal that very much do care, about diversity and inclusion in the workplace. So it's good for fellow employees, it's good for morale, but also, as we all know how difficult it is in this day and age to fully staff motivated employees, it's just something we need to do, and we need to get on the right side of it. So we offer, in California, it's pretty easy. We have Kaiser Health here, and in Southern California, we offer all our transgender employees Kaiser Health care, because Kaiser is way out in front of many other carriers in terms of offering, being cutting edge on offering transgender health care.
Fantastic. Thank you. That was so helpful. So we have I think we have some time for I have maybe one or two more questions, and then we're getting some great questions in from the group. So I might narrow mine down to just one more question from me, and then we'll move over to our really good Q&A. So beyond providing inclusive coverage, what are some other ways your company supports your transgender workforce? And Michaela talked a little bit about that, but let's start with Crystal again.
Sure. At Bank of America, we put into place in 2015 a program through our HR team that is called Life Event Services. And what we did conceptually is looked at what we called moments that matter, things where our employees were having difficulty navigating the benefits that we were providing and not providing as well as we would like to, times when employees were having major life events. And for example, when they needed a really complex leave of absence scenario, the paperwork, the return to work, their system access, just think about all of the things that go into a leave of absence. And the underlying is that you need a leave of absence, which means there is something going on in your life. So we were providing life event services support for leave of absence, survivor support for our employees who, or their families when an employee passed away. And our employee network was working on a proposal for how can we provide a better employee transition experience, kind of soup to nuts, and was doing a lot of external research, had created the business case, and had brought forward to leaders a proposal that we needed to do this better. That intersection point with Life Event Services was a game changer for our employees and for our company. So now in the U.S., across the entire space, and also in Hong Kong and Singapore, we provide one-on-one HR support through this Life Event Services team for transgender employees, for their manager, for their teammates, for a variety of things. From someone's changing teams who has already transitioned, someone is having difficulties with their medical benefits and the benefits that we provide. We serve as a liaison through our benefits providers to make sure that escalations are handled appropriately, quickly, that they get the right training, that they're providing the right service to our employees. Also, workplace transitions. We have a transition guide. Someone can launch just their initial questions when they're even considering transitioning. They can talk about benefits. They can talk about name change through our systems. It gives a single point of contact and allows a relationship to develop, and it goes on for as long as that employee needs it. And they can come back to the program if at some point in the future they need it. In countries where we don't provide this model, our HR teams are the first point of contact, and we provide support and services there as well. I will tell you that globally, we just launched the Hong Kong and Singapore piece in January of this year. It's more challenging because of laws, because of culture, because of benefits that are even available in the marketplace. And that is something that we are trying to proactively navigate right now. And I know you're doing the same thing, Dana, at Intel. And I think this is a place where there's a lot of work still to be done. And the more companies that ask questions of insurance providers and try to get our employees the benefits that they need and deserve, the more we'll be able to move that forward.
Great, thank you. And Dana?
So a couple things that we've done beyond the coverage. We provide a training for our managers, and it's very simply titled Supporting Transgender Employees. But again, it's an extensive training. Look through that. We also are in the process of creating a conversation guide for managers. So we've got the training, but we want to accompany that they have accessible to them. We do have a guide also called Transitioning at Intel, so that would be for the employees. Earlier this year, or excuse me, in January 2016, we added all gender restrooms at every campus at every U.S. site. So that's spread out, and that's U.S., of course, focused. But again, at every single campus, doesn't matter if it's 100 employees or what, there's an all-gender restroom there. We also have, if they want, and then we're working on creating a conversation guide talking about coming out to managers, for managers. So really a lot of focus on really the manager piece, and then for employees, and could be for others in the work environment. So those are a couple of the things that we're doing, as well as offering the benefits.
Great. Michaela, anything to add here?
Well, I'm just always so impressed when I see large companies, taking this comprehensive approach. So I'm really excited about Bank of America and Intel's approach. This last weekend, I spent 3 days at Twitter headquarters as part of Trevor Project board events with the board I'm on, and got a chance to speak to their inclusion officer at great length. Was very impressed with their trans task force and what they were, the program that they were able to put together. I mean, including they had pins that the employees would wear to work that gave their preferred pronouns. So it's some great programs that are going on out there. We're going to be speaking to some other groups this week, and I'm sure that there's a lot of good ideas out there that need to continue to be shared between companies.
Great, fantastic. So I'm going to move over to our Q&A section. We're getting some great questions. One of the most common ones we're getting is where people can start. So we're getting questions from ERG leaders and from different level executives that say, my company isn't offering this right now. How do I talk our heads of benefits and our HR directors into understanding the ROI and changing their policies and adding these benefits? So any advice on that question? And feel free to chime in on your own.
This is Dana, and I would say a lot of it, obviously starts with your culture. I really think it's important that when your company has a big focus on diversity, has a focus on an inclusive culture, adding the benefits, it's a natural step. I mean, granted, it's hard to kind of have those conversations, but I know, like I said, for us we were fortunate. It was very simple because we have a CEO who is very supportive of the culture and the environment, and so it wasn't this case of where we had to go and prove the ROI, but I think it really does start with that environment. And and it also depends on what other benefits and other programs that you have for the LGBTQ community. So I think that's a place to look at too, is your company considered LGBTQ friendly? And you may need to start, and if it's not, or if it is, start at that base and start with overall LGBTQ. And what can you be doing? Do you have an employee resource group? It sounds like some of them are from employee resource groups, but kind of growing from that grassroots, it may take that. Again, starting at the grassroots level is one approach, and adding more and more. I mean, this didn't happen overnight for either Intel or Bank of America. Again, we have a very inclusive environment, and so I know for us, we're able to build on from that. But then again, it came where, bam, we had a CEO who was very supportive, and so instead of we didn't have to focus completely grassroots, we were able to start at the top where he supported it. So just some thoughts there.
Yeah, Dana, this is Crystal. To add to that, I would say use what you think will resonate. Your culture. Presenting a business case is important. And the fact that these benefits cost very little to deliver, but benefit the employees that they impact exponentially, as well as benefiting your brand and other employees who just feel better about the company because their peers or their potential future peers would have the same coverage that they are able to access. I think those things can help to move in a place where culture may not be as easy or as far developed in this space. Another thing is the Corporate Equality Index. Use that if you need to, regarding how can we show ourselves as a great LGBTQ employer. And transgender benefits is one aspect of that. What I would tell you is, if you're going to ask for transgender benefits, why not ask for fully inclusive benefits, which isn't exactly what you need to get to the Corporate Equality Index 100% rating, but you do need to offer trans benefits. So, use the tools that you might have that might spark the attention of people who, want to present the best value proposition for employees and also make your company be as LGBT inclusive as possible, in the marketplace.
This is Michaela. I'd like to add to that just a bit. So, I've worked with hundreds of employees over the last year, job seekers, and hear various stories from all of them about their experiences in the workplace. And even in companies that have up to 100% in the HRC index, what one of you just said about the culture is so important, because sometimes that index, you can get a high score from policy decisions, but it's really the culture that decides how, in the end, someone gets treated and the kinds of support that we get. And one of the issues is, and I don't know if anybody on this call has this particular situation, is when it's a franchise type organization, where even in large hotel industries, there'll be franchise hotels and many other industries. So the culture, the score often doesn't take into account spreading that culture down through the franchise group, and that's where we're hearing a lot of the stories are from franchise groups of areas that have very high scores. So I just would like to say, that we need to make sure, that it's part of the culture, but that culture spreads throughout, all branches and all franchises.
This is Crystal. Just one more thing that I would add is never discount the power of an individual employee's story or the impact that they can have. We have had transgender employees arm in arm and sometimes leading the effort to propose new benefits, et cetera, along with allies, for sure. But, a story, a need, making it personal, along with the business case and, some hard, fast data and figures. Williams Institute is a great place to find some of that data. Out and Equal also has, a building the business case, set of information that you can use. But combined, it's kind of a 1-2 punch of the data, facts, and figures, how this will improve your brand and your customers' experience and your employees' experience with the, here's how this impacts X employee in their own words.
Thank you. And thank you also. I'm so sorry we don't have time for more questions. This is a jam-packed town call, but we're certainly keeping this conversation going throughout the year, through Out and Equal's research and training programs. And this will be a really significant focus at the summit this year. So please, I hope you'll be attending us in Philadelphia, October 9th through 12th, where we'll have an entire track and leadership day and a lot of focus on transgender policy and culture and how to make sure we're building inclusive workplaces. Thank you so much to all of our presenters. This was a really phenomenal town call. They're all volunteering their time to help us all build these really strong workplaces. So thank you to all of you, and thank you all for attending and for your participation. We're going to try and get to as many of these questions as we can. We'll filter them through the appropriate presenter and through our offices. So if you asked a question that didn't get answered, you'll hear back. So please do take the short survey at the end of the call. It helps us keep this program going and improve our town call series and keep doing what you're getting out of and polish them up. Our next town call is on LGBT workplace equality in India on Wednesday, May 10th at 8:30 a.m. Pacific time. You can find all of that information to register along with the recorded version of this call and past town calls on our website at outequal.org. Thank you again. Have a wonderful day.